Good afternoon. I want to start by talking about the current situation of the state and nation. Most of us are tired of talking about COVID-19, and many of us thought that once people were vaccinated, most of the problems would go away. But unfortunately, it's become clear that this isn't going away anytime soon. COVID will be part of our lives for quite some time. The good news is, because of our highest in the nation vaccination rate, as the country has endured Delta, we've maintained one of the lowest hospitalization and death rates in the nation, while leading in testing. But the virus is crafty and persistent, and it keeps spreading, and mostly amongst the unvaccinated. If you're still unvaccinated, I want to be clear, you'll be infected sooner or later. It's just a matter of time. And if you're unvaccinated and you get it, the data is clear. Over the last several weeks in Vermont, you're about 30 times more likely to be hospitalized if you're not vaccinated and boosted. But it's important to remember, though vaccines are good at preventing disease in the first place, their primary function is to prevent severe illness. And if you're 6 months from your initial doses, it's important to get your booster to keep this protection as strong as possible. From the very beginning, protecting our healthcare system has been our top priority. The fact is, unvaccinated adults are undermining that objective. Because even though they're about 5% of the population, they account for about 75% of the hospitalizations. And last week, there were days the unvaccinated made up 90% of the ICU. Let me repeat that. Just 5% of adults are creating over 75% of our problem in hospitals. The unvaccinated also account for over 70% of cases. While kids are a large percentage of this, fortunately, for the most part, they aren't ending up in the hospital. And many more are now eligible for vaccination. You've probably heard, and the press has certainly reported on, the demands of some to move back to the mandates of 2020, which would impact all Vermonters. You've heard me talk at length over the last several weeks about why I don't think we should reinstate mandates and continue to live under a perpetual state of emergency, more than 20 months into this, while we approach 90% of our total population having at least one dose. And we're not alone here, as President Biden and most other states have taken similar positions, including those with governors who are Democrats. But there's another important reason why I'm not going to put broad restrictions back in place, and that's because the vast majority of Vermonters have stepped up, done the right thing, and gotten vaccinated. And as a result, they're not the problem. I simply can't justify going back into a state of emergency, putting restrictions on the 95% of Vermont adults who have done the right thing and gotten vaccinated, when the problem is being driven by less than 5% of that population, meaning unvaccinated adults, who by now have had every opportunity to get vaccinated and have decided not to. The reality is, vaccines work, which allow those who are unvaccinated to do many of the things we had to leave behind in 2020 and the first half of 2021. And let's not forget, many restrictions, like mandatory distancing, gathering, and visitation limits, had a negative impact on physical and mental health. The hundreds of thousands of people who did the right thing and are therefore not the problem should not be punished to protect the people who have chosen not to protect themselves. A few months ago, Vermont became one of the first states to implement a vaccine or test and masking requirement for state employees. The policy has worked and helped increase our vaccination rate. I've encouraged other employers in the public and private sector to use this as a model. and we're going to increase that effort. In the coming weeks, my team will meet with trade associations, employers, and other organizations to talk through the benefits of requiring vaccination or testing for employees where we continue to see transmission. The science tells us that virus spread is much more likely to occur in settings where you're with someone for over 15 minutes, as opposed to brief interactions in places like convenience stores. In addition, restaurants, bars, and clubs are places where these types of longer interactions occur, and masking is obviously much less practical there as well. But vaccines have made it safe to go to places like these again, and that's a good thing. And we're also seeing a number of them require proof of vaccination at the door as a way to help keep everyone protected, which I think is a good idea, at least for right now. As a reminder, 18 to 29-year-olds have a lower vaccination rate than any other age band. Putting in place vaccine or test requirements will help prevent virus spread and keep employees from missing work. And we'll have more on this soon. But in order to make this strategy more successful, we're continuing our work to secure tens of thousands of rapid tests to give out to Vermonters at no charge. As we've said, securing this supply is a challenge, but we're getting closer. Last week, we announced a rule that requires commercial insurance companies to reimburse for these tests. But that doesn't cover everyone, and it's important we provide these tests to all, because this is the future, and rapid tests will be much more prevalent in our lives, and we hope to have more information on this effort in the coming days. Lastly, we're going to step up our efforts to get more boosters into arms. While Vermont is the national leader for boosters, we still have much more work to do. Over the weekend, Dr. Fauci was asked whether the definition of fully vaccinated would change to include someone who has received their booster. He said it's more likely a matter of when, not if. We want Vermonters to get ahead of this and think of it that way right now. If it's been 6 months since your second dose of Pfizer or Moderna, or 2 months since J&J, don't consider yourself fully protected unless you've gotten a booster. Waning immunity, on top of whatever impacts Omicron could have, makes getting your booster essential. While the initial doses worked well at preventing severe disease and illness for Delta, a booster will greatly reduce the chance of getting it in the first place. So we're going to launch booster campaigns similar to our aggressive approach with vaccines a year ago. The goal is to make it easy and accessible for all people to get maximum protection. If you get boosted right now, you'll be much more protected by Christmas and New Year's. I'll now turn it over to Commissioner Pieciak for his update.
Thank you very much, Governor, and good afternoon, everybody. Taking a look here first at Vermont's case counts for the past week, you can see that we did experience a reprieve from the surge following Thanksgiving. Cases were down in Vermont 15%, while at the same time cases were up across New England 19%. So Vermont stood out this week in terms of the direction of our cases, with 350 fewer cases this week than what we reported last week. And when you look at the numbers relative to the amount of testing and the positivity rate, you will see that testing was down over the last 7 days, about 10%. So maybe some of that decrease was attributable to testing, but at the same time, Vermont continues to lead the nation in the number of tests conducted for any jurisdiction. And you can see there that the positivity rate decreased a bit this week as well. So while testing did go down, it appears that cases were down as a result of lower virus infection as well. And when you look at the next slide, one that we've been showing regularly, you can again see the difference in that fully vaccinated and not fully vaccinated rate, about 5.1 times greater for those who are not fully vaccinated. And you'll also see that the biggest decrease came in that fully vaccinated rate as well, decreasing about 16% over the last week. As the governor mentioned, there is new analysis here relating to how effective boosters have been in Vermont to protect those from the most severe outcomes, including hospitalization and death. This analysis here that we'll show, this is looking at Vermonters 18 and older and comparing these populations that are not vaccinated, populations that are fully vaccinated but not boosted, and then those who are fully vaccinated with a booster shot. And as you'll see, those who are not fully vaccinated were 30 times more likely to require hospitalization over the last 6 weeks compared to those who were fully vaccinated and boosted. Similarly, on the next slide, you'll see a comparable analysis, but looking at fatalities. Again, this is looking at the 18 and older population, and similarly looking at the last 6 weeks. And here you'll see a similar dramatic difference. Those not fully vaccinated were 34 times more likely to die from COVID-19 over the last 6 weeks compared to those who were fully vaccinated and boosted as well. So that data is really clear for Vermont. It matches data that we're seeing across the country as well, that the effectiveness of the booster, particularly to keep people out of the hospital and those from dying, is highly effective. Also, tomorrow is the anniversary from the first dose of the vaccine being delivered in Vermont. An analysis that we have done, that we refreshed from earlier this year, estimates that in Vermont alone, 930 lives have been saved from the vaccine being available to Vermonters over the past year. So again, something else to be proud about in terms of Vermont's ability to go out and get vaccinated, but we need to continue to do that, and particularly do it as it relates to the boosters as well. Looking at the case rate slide, you'll see that the ages that are the most vaccinated and most boosted, that's 65 and older, continues to have the lowest case rates here compared to the other age groups. You will see all of the age groups are generally down this week as cases are down. But again, that big difference between the 65 and older, our most vulnerable population, which is important to see. Looking geographically at the cases, you'll see some improvement in the worst hit areas of the state from last week, particularly Bennington County. But at the same time, cases are elevated in southern Vermont, and that's where we're seeing hospitalizations as well in Rutland, Bennington, and a few hospitalizations now in Windham County at Brattleboro as well. Looking at the next slide, we're looking at our modeling slide that basically is the same story that we've seen over the last month or so. We're not anticipating cases will go down over the next 4 weeks. And in addition to that, there's some uncertainty that comes with the Christmas and New Year's holiday relating to the gatherings that will occur. And in fact, we do anticipate that cases will rise following those holidays, probably on the upper end of our projections over the next 2 or 3 weeks following those holidays. And you'll see that on the next slide as well. We track very closely to last year when we saw an increase when colder weather set in, a decrease following Thanksgiving because of a testing decrease, then a slow, gradual decline leading up to Christmas and New Year's. Again, we're following a similar pattern as last year. We just saw a larger surge after Thanksgiving, but we still anticipate cases will increase after Christmas and New Year's. So do everything that you can to prevent that or to make it as unimpactful as possible by getting boosted, wearing a mask, staying home if you're sick, and all of the other health precautions. Looking across the higher education campuses, you'll see we had 104 cases this week. That is the most that we've reported in a single week. Just by a single case, we had 103 earlier in the semester. Many of those cases attributable to the outbreak that's been reported at Middlebury College. Elsewise, the colleges and higher education was pretty quiet this week. Looking at long-term care facility, you'll see that the numbers are down again, just 29 active cases associated with an outbreak that are shown here on the slide, and a relatively small number of total outbreaks as well. Moving over to hospitalizations, you'll see similarly here some improvement over what we have been seeing the last few weeks. The overall hospitalization numbers remain flat this week. Also 72% of those in the hospital have been those not vaccinated over the last 7 days. On the ICU side, you see that we are declining about 8% over the last week, and again, about 77% of those requiring ICU over the last 7 days not vaccinated. Looking at the next slide, you'll see the availability of both the hospital beds and ICU beds. The hospital bed availability stayed relatively flat as the numbers stayed relatively flat, but ICU availability did tick up this week, providing some additional rooms. But again, still only with 11 rooms, I think, available today or yesterday, still something to be mindful of and cautious and look at very closely. Looking at the COVID-19 deaths so far for the month of December, we are now at 20 deaths for the month. I mentioned earlier the difference between those that are fully vaccinated and boosted compared to those who are not fully vaccinated. Another trend that we're seeing in the fatality data is just when you look at the raw number of individuals dying more recently, the number of people dying who are not vaccinated is greater than the number of people who are fully vaccinated or fully vaccinated with a booster. So again, it just supports that data from earlier. It just shows the importance of getting vaccinated because it is protecting people from the worst COVID-19 outcomes. Looking at our vaccination data, you can see number one across the board on most of these metrics. And then flipping on the next page, one that we've been watching closely, 5 to 11-year-olds. You can see Vermont is just under 50% for those that have a single dose, and about 25% for those who are fully vaccinated. So making good progress there, but again, we'd like to see that tick up a little bit more. And then finally, looking at the booster data, similarly, Vermont near or at the top on most of these metrics. We did cross the 70% of those 65 and older who are fully vaccinated that have received a booster. So that's great. We're seeing that impact in the hospitalizations and our fatality numbers. So we definitely want to keep that up for anyone that's over 65 or anyone that's over 18 that's eligible for their booster to go and get it today. So with that, I'll now turn it over to Secretary French.
Thank you, Commissioner Pieciak. Good afternoon. There are three mitigation strategies that we're implementing to prevent COVID-19 from disrupting the education of our children. Those three strategies are vaccination, testing, and the in-school recommendations for mitigation. Of these three, vaccination is by far and away the most important. In the 12 and older school population, more than 75% of the students are now fully vaccinated. And last week, the CDC extended its recommendation for boosters to 16 and 17-year-olds. We strongly encourage all 16 and 17-year-olds to get the booster when they're at least 6 months past the second dose of their Pfizer vaccine. Just a reminder, the Pfizer vaccine is the only authorized vaccine for the students in this age band. Vermont's success in adolescent vaccination will no doubt be pointed at the major variable that explains the difference we're seeing in the relative stability in our schools. In particular, our high schools this year are operating much more stable manner than our elementary schools. I think that's something we should be proud of compared to where we were last year with the amount of hybrid learning we saw in high schools. This year, high schools are operating very continuously, relatively speaking. And we're confident as the elementary level vaccination rolls out that we will see improved stability at the elementary level. To date, as Commissioner Pieciak highlighted, we're around 50% of the 5 through 11 population have received at least one dose or registered in the system to get their first dose, and we're about 25% have completed both doses. And Secretary Smith will highlight some more of this information in his report. We do expect 5 through 11 vaccination to make an impact on elementary school operations around mid-January. We do anticipate that this impact will be uneven across the state due to the differences in vaccination rates. Some elementary schools will have higher student vaccination rates than others. So we are working on plans to support those schools that have lower vaccination rates. Our response testing, including Test to Stay, continues to roll out steadily across the state and is contributing, I think, significantly to keeping more kids in school when we do have cases. For the last 3 weeks or so, we've seen about a 20 to 30% increase in the number of schools conducting Test to Stay antigen testing on a weekly basis. Last week, 172 schools conducted antigen testing under Test to Stay. Last week, we also saw the largest number of antigen tests being administered in schools in a single week. Last week, we had 5,194 tests administered under Test to Stay. We are starting to see enough data now that our health department's EPI team is starting to do some preliminary analysis of the EPI data from the antigen testing. The data seem to indicate a 0.9% average positivity rate. This includes tests administered for both students and staff. And we do have a few schools that have higher positivity rates in the 5 to 6% range. We can't make a direct comparison between the antigen test positivity rate and the broader state positivity rate as a result of the PCR testing, but the low positivity rate from the antigen test does confirm our perception that Test to Stay allows us to focus with some more precision on identifying cases in schools, and certainly helps us enabling students to stay in school as a result. So again, preliminary data, but it confirms our perception that Test to Stay is a really important strategy. Last week, we did expand Test to Stay to include pre-K sites in the public schools. We are working on implementing it in the private pre-K and the child care centers, and hope to announce that expansion after the first of the year. On a related note, we're working on an issue related to expiring antigen test kits. We knew some of the testing kits would expire soon, so we're working with schools to help prioritize the use of those kits and get them used up prior to their expiration dates. One strategy we are suggesting for schools is that they conduct broader antigen testing before the holiday break. We are recommending schools offer 1 or more days of mass antigen tests to all the students and staff who are signed up for the response testing. This will help us identify additional cases prior to the holiday vacation and give families some additional peace of mind as they gather for the holidays. Vaccination and testing will remain the cornerstones of our school mitigation strategy, but we'll continue to provide recommendations on the mitigation measures for schools to use in their operations as conditions evolve, particularly as we monitor the spread of the Omicron variant. We have a recommendation on wearing masks in schools that has been adopted by all schools in the state but one. In our recommendation on masking, we suggest also that masks are not necessary in schools when student vaccination rates reach 80%. However, we've delayed the implementation of that recommendation on 2 occasions this fall based on changing conditions of the virus. And currently, the go-live date for this recommendation is January 18th. The last time we adjusted the date for this recommendation was at the end of October. We set the date to mid-January in anticipation of needing to reassess conditions after the holiday vacation. I wanted to highlight today that our recommendations for schools like this one continue to evolve based on the conditions, and if conditions change, we'll make adjustments to those recommendations accordingly. That concludes my update. I'll now turn it over to Secretary Smith.
Thank you, Secretary French. Good afternoon, everyone. I'll start off with an update on boosters as well as vaccines for children 5 to 11. Then I'll provide an update on hospital capacity and some changes in hospital reporting. 197,883 Vermonters have received a booster shot. That's over 46% of the state's population that are ages 18 and over. And 16 and 17-year-olds can now get a booster. 22,436 children ages 5 to 11 have received their first dose of COVID vaccine, or they have made an appointment to get their shot. That's roughly 51% of all Vermont children ages 5 to 11 years old. If you have a child who is 5 years or older, please get them vaccinated. You can make an appointment by going to healthvermont.gov/myvaccine, or you can simply call 855-722-7878. Now, shifting to hospital capacity. As I've mentioned before, we have a 3-pronged strategy to reduce stress on our hospitals. Number 1, prevent hospitalizations in the first place. Number 2, transfer those from hospitals who still need care, but not necessarily hospital care. And number 3, expand the capacity of ICU beds in the state. So now let's talk about what we're doing for prevention. As you know, we continue to have a robust vaccination program, the best in the nation. It combines the capabilities and resources of the state, the National Guard, our healthcare providers, EMS, and our network of retail pharmacies. We are supplementing the vaccination effort with an expanded monoclonal treatment program. We've added FEMA-contracted paramedics and EMS personnel to support monoclonal treatment sites. EMS and FEMA teams will provide additional monoclonal antibody capabilities at hospitals across the state with mobile capacity to serve long-term care facilities with cases and wherever else needed. As of now, EMS teams are delivering monoclonal antibodies at Rutland Regional Medical Center and Northwestern Medical Center. Beginning as early as Friday, they will be at UVM-MC. They'll also respond to outbreaks at long-term care facilities. We expect the FEMA teams to arrive late this week. Their work will focus on additional capacity at hospitals across the state. As for transferring patients out of hospitals, back in October, anticipating a hospital surge, we opened up 80 subacute beds. Recently, we made an additional agreement for a total of 39 more beds in 3 long-term care facilities. So far, 19 of the 39 subacute beds have come online. We have the ability to add more beds as needed. In terms of ICU beds, the UVM Medical Center now has 5 additional ICU beds online, and Northwestern Medical Center added 2 additional ICU beds. 1 additional ICU bed is now available at Southwestern Vermont Medical Center, with another one expected to be operational soon. As you remember, 10 is our number that we're looking for. We're getting towards there, but we still are going to be trying to open up more ICU beds. As Commissioner Pieciak has pointed out, 72% of those hospitalized with COVID are unvaccinated. The numbers are higher, 77%, for those that are in the ICU and unvaccinated. Every morning, every single morning I get a report, and so does everyone up on this stage, get a report on the positive cases in Vermont. And consistently, as the governor said, over 70% are unvaccinated, with the bulk of the unvaccinated people being capable of being vaccinated. We are spending considerable amounts of money and resources to accommodate those that are not vaccinated and end up in our hospitals. It puts a stress on the system and takes away a hospital bed that may be needed for other hospitalizations that are not COVID related. And frankly, it's unfair to those that have done the right thing and gotten vaccinated, but now must pay for the actions of those that aren't vaccinated. I realize that Vermonters have a choice, but some choices have consequences. In this case, refusing to get the vaccine results in higher hospitalizations and stress on the healthcare system at significant cost. I'm asking Vermonters, I'm trying everything to convince Vermonters to please get vaccinated. It is simple and easy in this state. It is the most effective tool to fight the virus and protect your community. Turning to hospital reporting, we are making a change in the facilities that are included in our COVID hospitalization reporting after identifying an issue that was giving us an inaccurate count of people hospitalized for COVID. The Brattleboro Retreat and the Vermont Psychiatric Hospital currently report COVID cases in their hospitals. However, that does not give an accurate picture to make a hospital capacity decision. In reality, patients are hospitalized at these locations for reasons unrelated to COVID. And if they need hospitalization because of COVID, they are transferred to a hospital for treatment. Put simply, even though they're not being treated for COVID, they're being counted simply because they are COVID positive in one of these facilities. Therefore, to more accurately reflect our COVID hospitalizations, these 2 facilities will be treated like other congregate living facilities for reporting purposes. Just a few quick updates, as Commissioner Pieciak talked about in his higher education update. There was an outbreak at Middlebury College. Within a day, the state set up 4 additional testing clinics in the town of Middlebury. This accounted for more than 500 additional appointments for people to get tested over the weekend. We also distributed around 400 rapid at-home tests within the community. And finally, I just want to continue to talk a little bit about testing here. We continue working to get Vermonters access to at-home rapid tests. We expect more rapid tests to be delivered to the state and used throughout the holidays. All the information about what to do if you test positive for COVID-19, including reporting your status, especially with some of these take-home tests, is on the Health Department's website. Go to healthvermont.gov/COVID-19 positive. You can also, like I said, call the hotline at 855-722-7878. As always, thank you for doing your part to keep Vermont safe. I'll now turn it over to Dr. Levine for a health update.
Thank you. Heard a lot of numbers this morning. I'm going to focus on what I want to help you accomplish, what you should do as we approach these next few weeks. Obviously, we're still in a very challenging stage of the pandemic, seeing high levels of virus spreading through our communities and more people in the hospital with COVID-19. But vaccination continues to protect the majority of Vermonters from severe outcomes. But older people and those with underlying conditions still remain at risk. At the same time, we've also been living with COVID-19 for so long now that I know that many of you are just plain over it, trying to live your lives once again, and I get it. The strains on our mental and emotional well-being are far beyond anything many of us have ever experienced before. However, there is a balance to how we live with this virus. The more we can reduce the risk of spreading the virus as a regular part of our daily lives, the less we need to worry about it. We'll be healthier, we'll keep the most vulnerable safe, lower the burden on healthcare workers, and others who are simply burned out with this relentless response work. So remember the basic steps to protect one another as we plan ahead for the next holiday gatherings. First, have the talk before you go. Find out whether people will be vaccinated, boosted, or if extra precautions need to be taken for anyone who may be sitting around the table at higher risk, such as wearing a mask when you're not eating. Keep it small. The more people in households, the higher the chance that someone could have the virus and expose others. Have a strategy for testing. Get tested before you gather to protect everyone. You can use a rapid at-home test kit, which typically calls for one test 1 day or two before the gathering, and the other the same day you will be gathering. That helps make sure that if you have a negative result, it is accurate. And of course, if you have symptoms, even mild ones, choose to skip the event and stay home. While this decision can be hard, the flexibility is key to keeping others safe. Finally, plan to test once again 5 to 7 days after such a gathering, even if you're fully vaccinated, even if you don't have any symptoms. As you've heard, we are continuing to transition testing opportunities to having more free rapid testing options for Vermonters. And these kinds of self-tests are a critical risk reduction measure, along with vaccination, masking, and other strategies. Not only do they produce quick same-day results, they're also more convenient and easy to use. As I've said before, the most important step you can take right now is to get your booster shot, if you haven't already. This includes the fact that 16 and 17-year-olds who are now approved to receive a Pfizer booster following federal authorization last week. We lead the nation in boosters, but that's clearly not enough at this point in time. We need to be well above a 50% threshold with Delta and knowing all we know about it, and with Omicron on the horizon. Because as I said last week, you are not fully protected until you've gotten that booster, if it's been 6 months since your mRNA vaccine or 2 months since J&J. And I base this on all the evidence we have with the Delta variant, which currently makes up 100% of cases in Vermont. In addition, there's now emerging data from the UK and Israel regarding the Omicron variant. And it shows that there is loss of protection from infection if you've only had a 2-dose series, and that a 3rd vaccine dose will provide considerable defense against the new variant. There are also early indications, based on the relatively few cases we have in the United States, that the rate of breakthrough infection will be higher, but the vaccines will still protect us against more serious outcomes if you've had the 3rd dose. Now, while the data around this new variant is new and emerging, it currently supports what we've been saying all along. Vaccines are the most effective protection against bad outcome, serious illness, hospitalization, death. This protection depends on you being up to date and fully protected. It means a 3-dose series, whether you call the 3rd dose a booster or something else. Now, as scientists are gathering more information on this variant and Delta cases continue to surge, the time to protect ourselves is now, today. We have still not found Omicron in Vermont, but it's been found in many U.S. states, including now all of our border states and our border country. We're continuing our genetic sequencing work with Broad Institute and our own public health lab. Burlington continues to do wastewater sampling, and it has not been detected there yet. We'll certainly inform Vermonters when, not if, Omicron is identified in our state. You can find a clinic, including walk-in opportunities, at healthvermont.gov/myvaccine. We consider the 3rd dose so essential to our future success in Vermont that we are now still one of the few states where state-run clinic opportunities are in abundance. Last week, I had a special message for the unvaccinated Vermonter. Get a COVID test as soon as you have symptoms, so that you can avail yourself of monoclonal antibodies, which could save your life, could prevent a hospitalization. But you need to test yourself and recognize these symptoms before you require hospitalization. I have another message for you today. Look at the data that you've seen presented, especially the percentages of ICU admissions and deaths among those who are unvaccinated. Let that data speak to you as you think about your own risk. And if someone that you know is not yet vaccinated, help them understand this data. Or if someone has not yet vaccinated their child, help them understand the data. And think about how you can help them with their decision. Talking to them about the benefits of vaccination, listening to their concerns with empathy, helping them find their own reason to get vaccinated, helping them find a trusted source of information. These are all ways we can influence our friends and loved ones without blaming or shaming. Getting vaccinated can even be a gift to your loved ones this season, a time when we try to think of others. In closing, we need to respect and protect one another right now. Respect the highly contagious nature of the virus, and respect one another by staying home when you're sick, putting on your mask in public places, and sometimes even in private indoor settings. What does protect really mean? Protect one another. Think of the most vulnerable person in your life. What could happen to them if they got COVID-19? If we all work to protect that person, we protect our families, our friends, our coworkers, our hospitals, indeed, our whole community.
Thank you, Dr. Levine. We'll now open it up to questions.